Are there any other votes? Announce the results.
Ayes 123, noes 0.
The bill is passed. Mr. Morelli.
Yes, sir. I'd now like to take up on debate on page 56 of the main calendar, calendar number 344 by Mr. Cahill.
Clerk will read.
Assembly 8135B, calendar number 344, Mr. Cahill, an act to amend the insurance law.
An explanation is requested, Mr. Cahill, but before we get there,
Hey, Fletcher.
not quite yet, Mr. Cahill, still a little bit. Really like to have everybody settle down. It is Monday's calendar.
Ready?
Okay, Mr. Cahill, let us proceed.
Thank you, Mr. Speaker, and thank you for your patience in bringing the House to order. This piece of legislation, quite simply, would require health insurance policies to include coverage of contraceptive drugs, devices, and products, as well as voluntary sterilization procedures, contraceptive education and counseling, and related follow-up services. It would also prohibit any cost-sharing requirements or other restrictions or delays with respect to this coverage. Mr. Speaker, and I will add, in compliance with Health and Human Service guidelines under the Affordable Care Act and our Essential Health Benefit Plan.
Ms. Corwin,
Thank you, Mr. Speaker. Would the sponsor yield?
will you yield, Mr.
Certainly, Mr. Speaker.
Cahill?
Thank you.
Sponsor yields.
Thank you, Mr. Cahill. Yes, you had specified that it would put it in compliance with ACA. My understanding of ACA right now is that it requires that at least one brand or type of each of the 18 forms of contraception must be made available without a copay. What this bill does is it actually expands it so that all brands, all versions would be copay free and covered under insurance.
It's my understanding, Mr. Speaker, Ms. Corwin, that this bill is in conformity with the HHS guidelines that would require coverage for one form of contraception in each of those 18 categories. That's what the federal law requires, and I believe that's what the language of this bill requires as well.
My understanding of the language of this bill, it goes much farther than that, in that it requires it for all the other forms as well. So there would be a significant increase in the number of items that would be covered under insurance and then also not have copay.
There may be a condition with a statement of medical necessity that could result in another form that is not one of the 18 that's chosen to be covered without a copayment as well.
Okay. My understanding also is this bill would also require that no less than 12 months supply must be made available.
Well, actually, what it does, it allows pharmacists or requires pharmacists to dispense 12 months should a doctor prescribe. The coverage already exists in law.
Okay, but my understanding is you don't need a doctor's prescription. The individual would be able to come into the pharmacy.
Oh, that's emergency contraception.
Okay, with the emergency contraception, they would be able to come in, though, and they would also be given a 12-month supply?
No, the emergency contraception is a one time only.
Okay, does the language of the bill actually specify emergency contraception? Because my reading of it says contraception only, meaning that they can get any form, including emergency, for a 12-month supply.
Well, there is no such thing as a 12-month supply of emergency contraception unless you are particularly active, in which case gee, I think they have a bigger problem on whether their prescription is going to be covered without a copay.
I see, but you can see my concern here is that when pharmacists and so on read the language of the law, if it isn't very specific,
You
then
can't-
potentially someone could make that mistake.
Pardon me for interrupting. You can't give a 12-month supply for which there is no 12-month supply. It's a pill.
Okay, right, so they can't be given 12 pills.
That's not a 12-month supply. There is no such thing.
No. All right, we'll beg to differ on that.
Okay.
As far as age restrictions, are there any age restrictions included in this bill as far as the youngest age that would be eligible to be able to come in and receive emergency contraception?
We don't change that law at all.
Okay, so because there is no age restriction according to the ACA, so this would not impose one either.
That is my understanding.
So theoretically, a 12-year-old, assuming she's menstruating, would be able to come in and receive emergency contraception at the pharmacy?
Yes.
Okay. And would this 12-year-old be able to get regular forms of contraception as well?
This doesn't change the law with regard to that either.
Okay. So as far as that 12-year-old who comes in, because oftentimes maybe not often, but there are times when people have side effects from going on a certain form of contraception and they have to change it and try something else. Would that 12-year-old receive a 12-month supply of that contraception and then be able to come back and get another one?
This does not change the existing law right now. If a doctor determines that that is an appropriate prescription, which I doubt that a doctor would for a 12-year-old, then this law merely says that a pharmacist can dispense it.
Okay, I see. And none of this is done with any kind of parental guidance or notification?
This does not change the law in that regard.
What we're looking here is expanding the number of forms that are going to be required to be provided under coverage. What kind of cost figures do we have as far as what that expense would be?
Well, of course, we don't have cost figures for New York State because it is not a practice that is adhered to by health insurance companies, and it's a good time to point out that although it was a requirement imposed upon insurance companies, both because of the Affordable Care Act and our own Essential Health Benefits Plan, an investigation by the Attorney General determined that compliance was not perfect, was not good, and that's the reason for this legislation. However, in answer to your question, it's twofold. Number one, there is no additional cost to the state, of course, because it's not an expansion of an essential benefit, so there's no cost to the state. Number two, it will significantly reduce unintended pregnancies, which will cost far less, therefore, than if those unintended pregnancies were to occur and be covered by that insurance plan.
I always find that argument very interesting because a lot of people draw conclusions that, well, by providing this service at cost X, we will eliminate Y, and therefore we will come out ahead. But no one ever has any numbers to really prove that out.
If I may address that, Mr. Speaker, this is somewhat different. In many of those instances, we talk about the cost of prevention, saving us money for what might eventually be the cost of treatment for a disease we failed to prevent. And that cost is oftentimes compared one calendar year or one contract year over a course of many, many years. So it's very difficult to determine that math. But in this case, this is about stopping an unintended pregnancy. And that effect is felt immediately. The cost savings are clear. The experience in other states that have had similar conditions present where studies were done, and I have a study done in California on this, indicate that indeed it saves money, does not cost money.
Okay. To get back to the comment,
I'll be happy to share that study with you, too. I actually have one.
I'd love to see dollars and cents determined by an actual study that tells us exactly what the dollars are in terms of unwanted pregnancies versus what this would cost, because I think it would be very interesting to look at. However, getting back to something else you said regarding the essential benefit, now, it is your position that this bill would not expand any costs regarding our Medicaid program, because, of course, if we're expanding coverage, that means we'd have to make sure the Medicaid program keeps up, and that means taxpayers would be paying for that.
This doesn't relate specifically to Medicaid or Medicare. What it does talk about is commercial insurance that's provided to individuals and families in the state of New York. And it is not my interpretation that it's not an expansion of an essential benefit. It's an interpretation by the Health and Human Services Agency that elimination of co-payments and co-insurance charges is not an expansion of essential benefits. The only benefit that does not come out of the guidelines put forth by HHS is the coverage of vasectomies, voluntary sterilization services for men. And that gets covered under another condition, and that is that it is already part of the plan that was chosen as our essential health benefits package here in New York State. So either way, neither side of this equation is an expansion of existing benefits, and therefore there is no additional cost to the state of New York as a result.
Okay, just one other question regarding this bill. My understanding is that we're expanding the number of people who would be eligible to provide this emergency contraception. We're allowing midwives who previously weren't allowed to provide that. So I'm trying to think here. Certified nurse practitioners, physicians, licensed midwives would now be eligible to prescribe and order non-patient specific standing orders. Oh, I'm sorry, that's who already has it. We're expanding it to registered professional nurses for either dispensing or administering emergency contraception, and to pharmacists for dispensing it. So are we not also increasing the amount of it that's going to be prescribed if we're increasing the number of people who are able to prescribe it?
No, we're not altering the scope of practice of any profession in New York State. What we are doing is making sure that those people who are already in contact with those folks who might be interested in availing themselves of this benefit can do so without unnecessary and additional complications of having to visit multiple providers. This doesn't expand the scope of practice. It brings those all in conformity, parity, if you will, in terms of handling this particular aspect of folks' health care.
Okay, thank you, Mr. Cahill.
Thank you, Ms.
That's
Barr.
all my questions. I believe I have some of my colleagues who have questions as well. Thank you.
Certainly. Mr. Graff.
Will the sponsor yield?
Yes, Mr. Speaker.
Mr. Cahill yields.
Okay, so under this bill, correct me if I'm wrong, all insurance companies would have to cover this?
You're wrong. I'm
Okay.
correcting you. You said correct you if you're wrong.
Okay.
Not under this bill. Under existing law, they are required to cover them. This brings them into conformity
All right, how
with
about-
existing law.
How about Catholic hospitals?
If a Catholic hospital is not currently required to provide this, a Catholic hospital would still not be required to provide it. The religious exemption remains intact, is not altered in any way.
And it's also the sterilization, the voluntary sterilization. It doesn't expand it to the Catholic hospitals?
The religious exemption, as it existed before this law takes effect, will exist exactly the same after this law takes effect. The answer to your question, I'm not sure how you phrased it, is either yes or no.
Okay.
If you said, are they going to be required to cover it if they're not now, the answer is no. If you said, are they still exempt, the answer is yes.
Are they going to have to perform this in a Catholic hospital?
It doesn't change the existing law with
Okay.
regard to that.
Now, closed corporations, okay, they would have to have this as part of their insurance?
It is part of the insurance mandate put down by the Affordable Care Act. It is part of the insurance mandate that is available to every New Yorker based upon our configuration of an essential health benefit plan.
All right. How does this conform with the new case with Hobby Lobby, where a closed corporation with strong religious beliefs?
However it is applied today, it would be applied after this became the law. It doesn't change the application of that court decision in New York State. And quite frankly, I can't tell you how New York State regulators have chosen to regulate in view of that somewhat questionable Supreme Court decision.
Okay. All right. Thank you very much.
Thank you, Mr. Graff. Thank you, Mr. Speaker.
Mr. Buckland.
Thank you, Mr. Speaker. Would the sponsor yield?
Yes, I will, Mr. Speaker. Thank you,
Mr.
Mr.
Cahill
Bartlett.
yields.
Thank you, Mr. Kay. I'll just have a short question because I'm getting confused on earlier debate, and maybe I didn't hear the explanation of the bill clear enough. Our colleague was asking you questions about whether this expanded essential health benefits. Your position, it does not expand those benefits?
That is the position taken, yes, that's my position. It's also the position taken by an interpretation of the Health and Human Services Regulation because it is already required under the ACA and part of our essential health benefits package.
And then with the voluntary sterilization, vasectomies, I suppose is what you're getting at, I didn't understand your explanation on that. That it isn't required under Obamacare, but under some other type of, the state benefits?
It's part of our, Mr. Speaker, it's part of our essential health benefits package right now, which every plan is required to adopt.
So what is the purpose of this legislation?
To bring our health insurance companies into conformity and give the power of a statute behind the enforcement of the law. What happened was that the Attorney General Eric Schneiderman, dispatched a group of people he called secret shoppers. And he dispatched them to the insurance world to say, I want this benefit, I want to use this benefit, I want to take advantage of this benefit, and they met a variety of different approaches to resisting the implementation of this benefit. What the Attorney General did was propose legislation, and that's this legislation, that would make sure that it was perfectly clear that our insurance companies had to be in conformity. So this is truly just a conformity piece. I don't think
Like
it's
a clarification piece? Is what you're saying?
clarification.
Under Obamacare, if someone's not following the essential health mandates, there's got to be some sort of enforcement mechanism there for the Attorney General or someone else to make sure that the insurers follow those rules?
Mr. Speaker, Mr. Barkley, I'm certain that if the Attorney General chose to do so, he could bring a lawsuit against these insurance companies at great expense to the people of New York State and the insurance companies. But instead, getting at the heart of the matter here and making sure that there's clarity and that these benefits must be provided was the approach that he thought was the appropriate way to deal with it. And it's also, quite frankly, the way I think it's appropriate to deal with it.
The other just questionable, I'm interpreting it differently. I think there are additional mandates in this bill. The one that sticks out is the 12 months, providing 12 months of contraception. Is that, other states are providing 12 months under Obamacare, not pursuant to their other mandated statutes that they may pass in their legislatures?
Thank you. Mr. Speaker and Assemblyman Barkley, it is already a mandate on insurance companies, and it is already the authority of a prescriber to prescribe a 12-month prescription for oral contraception. What this does is permit or require, I'm not sure which, I can find out for sure, a pharmacist to actually dispense that. And just a point in fact, in California, a study was done of contraception that was dispensed for 2 months, contraception that was dispensed for 3 months, and contraception that was dispensed, oral contraception that was dispensed for 12 months. And as a result of that study, it was determined that there was a 30% reduction in unintended pregnancies and a 47% reduction in abortions for the people in that category. So it had the effect in actuality of helping people avoid the need for an abortion.
Do you remember a few years back, Kevin, where you passed some legislation that was going to set up a mandate committee that would look at any insurance mandates to see how much the cost-benefit was of these mandates? Do you know whatever happened to that committee?
I do not.
Well, I can tell you what happened. It never met.
Whatever happened to that committee? Do you mind if I ask you a question?
This might be a good opportunity. You say you have a study from California. Who did the study? Who did the study in California?
Oh, thank you. The study was done by the Bixby Center for Global Reproductive Health, Department of Obstetrics, Gynecology, and Reproductive Services, San Francisco General Hospital, University of California. The author was Dr. Diane Green Foster, and I'll be happy to provide you a copy of it. It appeared in the American College of Obstetricians and Gynecology Journal, volume 117, number 3, March 2011.
I haven't run across that, Kevin, but I look forward to reading the study. So thank you for indulging my questions.
Mr. Hawley.
Mr. Speaker, could I ask the sponsor one question?
I yield.
A singular question. Why does this proposal prohibit copays and coinsurance, unlike prescription drugs where there is a copay and is a deductible, if you will?
Thank you, and it's a very important question. It's required under the Affordable Care Act.
But this proposal is not under the Affordable Care Act.
The bill before us, where copays and coinsurance charges are taken away from insurance companies, where they're prohibited from charging them, is in compliance with the Affordable Care Act. The Affordable Care Act prohibits those charges.
Thank you.
Mr. Goodell.
sponsor yield?
Certainly.
Mr.
Oh, getting up and down counts as
Delgado.
my steps for the day.
We don't want you to get too comfortable,
I'm
sir.
good.
Thank you, Mr. Cahill. I see that the bill specifically excludes as an exemption religious employers. That's on page 2, line 46.
Yes.
Is there any exemption for non-religious private sector employers in your bill language that fall within the definition of Hobby Lobby?
No.
Is there anything under current law that prohibits an insurance company from offering this benefit on their own?
Is there
That
any?
is, waiving any copay, deductible, co-insurance, or anything else on contraceptives?
Well, not only is there nothing in current law prohibiting it, it's currently required. We're reemphasizing it in this law.
If eliminating the copay, deductible, and all these other costs and providing up to 12 months of coverage would save a lot of money, as you suggest, tell me, why haven't the for-profit insurance companies already done this?
I think
You have-
some, I'm sorry, Mr. Speaker, I think some have already done it. This was an inconsistency in practice by insurance companies that was uncovered by the Attorney General. By and large, I think that many companies probably were adhering to the ACA and our Essential Health Benefits Plan. This would just assure that it is the case uniformly across the board.
Have you received any indications from the insurance industry itself that if this were implemented and they were forced to provide up to 12 months of contraceptive coverage at no expense whatsoever, regardless of age, that it would cut their costs? Or have you heard anything at all from the insurance industry itself?
Well, this is a current requirement on insurance companies. It is a current authority of doctors to prescribe this. What this does is allow for the 12-month dispensing. So, no, I have not received data on that specific question or the implementation of this bill over and above that which is already required under the law for health insurance companies to adhere to already.
Is it your position that the ACA, the Affordable Care Act, mandates this type of insurance coverage for young children under the age of 18 without any parental consent?
This does not alter the current law in that regard, either insofar as the ACA is concerned. Of course, we can't alter that law, nor does it alter New York State law in regard to that.
My question was, does the ACA prohibit parental notification or parental consent?
Does the ACA prohibit parental notification or consent? It is my belief that the ACA does not prohibit parental notification or consent, but it is not necessarily a practice in New York State, nor is it the law in New York State.
So if we wanted to, we could say that if you're prescribing contraceptives to a 12-year-old, you must notify the parent. That would be within the scope of our authority as a legislature to ensure that parents have some idea of what their young children might be engaged in, right?
I believe that would be a separate debate.
And that is not included in this bill.
Not a part of this debate.
Thank you. Thank you, Mr. Speaker.
Read the last section.
This act shall take effect January 1st, 2017.
Clerk will record the vote. Mr. Cahill to explain his vote. No, not yet.
Thank you,
You'd
Mr.
like
Speaker.
to defer?
I will defer if you don't mind.
Ms. Bashat to explain her vote.
Thank you, Mr. Speaker, for allowing me to explain my vote today. First, I want to thank my colleague for introducing this bill. Today, I rise as a strong advocate of pro-choice in support of Bill 0125B, which is to have all types of contraceptive covered by insurance. This legislation adheres to a truly New York principle that access to health care is a right. Notwithstanding level of income, insurance companies will be mandated to support contraceptives. I represent a district that is composed of lower to middle income families and families of color, where the economic disparity has limited these individuals to have access to health care resources and products, which essentially stands in their way of having a better quality of life. This bill will reduce unintended pregnancies, prevent sexual transmitted disease, and increase the savings. Today, with the passage of this bill, all of this will change. Thanks to the Genius Affordable Care Act, nearly all American households have health insurance. This bill currently on the floor will build on the tremendous fact, and again, as a pro-choice advocate, we have to remember that the Supreme Court has constantly held that access to contraceptives is covered under the umbrella of constitutional privacy. Support of this bill sends a message that will vibrate through all of New York. That message is that Albany stands with families, where there may be man or woman, rich or poor, black or white, or whatever. I implore my colleagues to support this bill. Thank you. And I vote in the affirmative. Thank you.
Ms. Bashat in the affirmative. Ms. Seawright.
Thank you, Mr. Speaker. I rise today to speak on behalf of this important legislation. Today, I proudly vote to expand access to contraceptive coverage for women and men. This legislation requires health insurance companies to provide contraceptive coverage without cost sharing, better known as copays. Coverage for all reproductive health services is imperative for women's equality. Thank you.
Ms. Seawright in the affirmative. Ms. Samotis.
Thank you, Mr. Speaker. I rise today to thank the Attorney General and the sponsor for all of their hard work with respect to this bill. As a woman with a young family, I understand firsthand how important it is for families to have the ability to make informed decisions about their health and plan for their futures. Every woman deserves the freedom to determine with her doctor which method of contraception best meets her needs and that of her family's. Federal law guarantees cost-free coverage to all federally approved methods of birth control, yet the women of New York continue to be denied timely access to family planning options. This bill will address these disparities and ensure all patients can make informed choices about their reproductive health without facing unnecessary costs or burdensome delays. Quality reproductive health care is fundamental to the physical, economic, and social well-being of all of our communities. This bill will eliminate barriers to care, improve public health, and advance gender equality in our state. Again, I'd like to thank Attorney General Schneiderman and the sponsor, Kevin Cahill, for all of their work. Thank you. And I vote in the affirmative.
Ms. Samotis in the affirmative. Mr. Palmisano.
Oh, no, sorry, hit the wrong button.
That's a no. Mr. Cahill.
Thank you, Mr. Speaker. By way of explanation in explaining my vote, I will just revisit one quick point in the debate, and that is that the Supreme Court has indeed ruled in a case involving the governor of the state of New York and emergency contraception or contraception for people under the age of 16, and they've ruled against any restrictions. So this is in conformity with the Supreme Court decision in that case, in conformity with the guidelines put out by the Secretary of Health, Education, and Welfare, or whatever the current HHS is, Health Human Services. In closing, I just wish to express my great thanks to the advocates across New York State who have continued to make sure that these issues remain in the forefront of our consciousness here in Albany. There is an assault across the country on family planning issues. There is an assault in some states that have made it virtually impossible for people who wish to exercise their legitimate lawful right to family planning services to achieve that. Here in New York State, we pride ourselves on making sure that that right is protected in every single way. I applaud the Attorney General for his efforts in uncovering this practice that compromised that right. And with that, Mr. Speaker, I also thank my colleagues who were very helpful in drafting and moving this legislation forward. I withdraw my request and vote in the affirmative.
Mr. Cahill in the affirmative. Are there any other votes? Announce the results.
Ayes 83, noes 36.
The bill is passed. Mr. Morelli.
Mr. Speaker, I understand there are resolutions in housekeeping. We should take those up at this time, sir.
Housekeeping first, Mr. Morelli, on a motion by Ms. Weinstein, page 7, calendar number 20, Bill 245, amendments are received and adopted. On a motion by Ms. Paulin, page 15, calendar number 86, Bill number 1872B, I offer the following amendments and move their adoption. And remove the stuff. It's already moved and adopted. And we have numerous fine resolutions which we will take up in one vote. All in favor of resolutions, please signify by saying aye. Opposed, no. The resolutions are adopted. Mr. Morelli.
Yes, Mr. Speaker, could you please recognize Ms. Schimmel for the purposes of an announcement?
If we can get some quiet, Ms. Schimmel has something to say to us. Ms. Schimmel?
Yes, Mr. Speaker, there will be a majority conference in the Speaker's conference room at the close of session. Thank you.
Mr. Morelli.
Yes, thank you, Mr. Speaker. I now move that the Assembly stand adjourned until 11:30 a.m. Tuesday, January 26th, tomorrow being a session day, sir.
The Assembly stands adjourned.